Item. SCP-400. Object Class. Euclid. Special Containment Procedures. The single colony of SCP-400 in Foundation custody, designation SCP-400-B, is currently housed in a juvenile humanoid containment cell at Site-77's Euclid Objects Wing. Any cell containing an active SCP-400 colony must be secured with an airlock door under Biosafety Level 4 precautions. Any openings for ventilation must be covered by a metal screen with gaps no greater than 0.2 cm in diameter, followed by aerosol filter 400 AF to be changed monthly and remanded to on-site chemical research personnel with Level 3/400 clearance. Access for experimentation purposes requires approval from both the Ethics Committee and the item's acting HMCL supervisor. Currently Dr. Marshall Grant. SCP-400 handlers are required to wear Level 4 positive pressure biohazard suits, and must be decontaminated prior to egress. In emergency situations, prevention of olfactory contact with SCP-400 is sufficient to prevent accidental exposure in most cases. For caregiving instructions, please refer to Document 400C Rev 1.3. Agents operating in the continental United States are to report any statistically significant drop in daycare, preschool, and primary school enrollment in their assigned region. Elements of MTF Beta 7, Mazhatters, are to remain on call for identification, research, and termination of active SCP-400 infestations. Locations found to be infested are to be quarantined using Cover Story 139-B. Bubonic plague. Media inquiries are to be categorically denied, and all agents of the press demonstrating interest in the quarantine are to be detained and administered a Class B amnestic prior to release. Foundation personnel affected by SCP-400 are subject to quarantine of up to 3 weeks. If by this time anomalous effects have subsided, personnel are subject to psychological evaluation prior to return to duty. If anomalous effects are still present after the administration of a Class A amnestic, remaining personnel may be reassigned to non-anomalous research, administrative, and medical positions. Civilians exposed are to be administered a Class A amnestic prior to release. Please refer to Document 401R for reintegration instructions by geographic region. Damage control for infestations affecting population centers of 500 persons or more may employ amnestic agent on We-02 locally if necessary. At least one active SCP-400 colony must be collected from all subsequent infestations, and remanded to genetic research personnel with Level 3/400 clearance. Description: SCP-400 is the collective designation for an anomalous species of arthropod similar to Armadillidium vulgar, or the common pill bug. SCP-400 individuals are morphologically similar to A. vulgar in appearance, but can be distinguished visually by bright red striping patterns on their dorsal carapace. Visual identification is only possible by individuals not under the influence of SCP-400's anomalous effects. SCP-400 is a parasitic organism which feeds on human mammary secretions. Access to this food source is gained by habitation and manipulation of deceased human infants. Affected persons are subject to a Type 3 cognitohazard via a pheromone vector, which reproposes the natural child-rearing instincts present in all humans for its own feeding and protection. Those subject to this effect are unable to perceive SCP-400 or the damage it causes to infants. Exposure to D-class assets has determined that the effect does not apply to video or audio surveillance, and that Level 4 biohazard precautions are sufficient in preventing the effect's onset. Personnel briefed on SCP-400's effects show no special immunity to the false perceptions created by the anomaly. As of the 14th of July 2005, the Ethics Committee has determined that future human experimentation with SCP-400 will only be allowed in unique and dire circumstances. As such, all information regarding SCP-400's relationship with humans and life cycle have been compiled from extensive surveillance and interviews conducted in the site of SCP-400's discovery. Conclusions are based on an observational period from August 2003 through July 2005. Infestation begins when 25 to 50 instances of SCP-400 select an infant 1 and access its crib. Observation has failed to detect any instance of SCP-400 prior to appearance within the target crib. Parents and D-class personnel present will be unable to perceive SCP-400. If any person passes within 0.5 meters of the infant, SCP-400 instances will collectively release a fine spray, which causes immediate disorientation and rapid loss of consciousness. SCP-400 will then begin to burrow into the flesh of the sleeping infant. Favored points of entry include the mouth, eyes, anus, navel, and armpits. The infant will not react to the presence of SCP-400 in any fashion, suggesting the use of local anesthetics. Cardiopulmonary activity in the infant will cease within the first 40 minutes of this procedure, and within 3 to 5 hours, movement will resume, followed by strained vocalizations. At this point, the infant is considered an active colony of SCP-400. Incapacitated subjects will awaken soon after the first vocalization and investigate. Parents or other adults present within earshot will also show interest as per normal for distressed infant vocalization. If the original mother of the colony is present at this time, she will immediately begin breastfeeding regardless of previous feeding schedule or practices. Over roughly the next 10 weeks, parents and other adults begin to show increased affection and protectiveness toward the colony. During this stage, direct observation by present adults and children will be unable to detect any abnormalities in the colony's physiology, despite numerous dermal perforations and jerky, unnatural movement. The colony is capable of basic vocalization, and is able to emulate feeding, defecation, and play behaviors of normal infants with increasing proficiency. Decomposition is still visible via surveillance during this time, culminating in desiccation of the colony's remaining soft tissues too. By the end of the 12th week, all observed colonies exhibited increased size, such that individual instances of SCP-400 are visible moving under the skin. Such colonies are considered mature, and individual instances will begin reproductive behavior during this period. During feeding, 7 to 12, SCP-400 individuals will exit the colony through one of its dermal perforations, and take hold of any exposed portion of the host mother's skin for approximately 10 minutes before returning. Host mothers studied during this time begin to show increased progesterone production, as well as heightened levels of human chorionic gonadotropin, indicating an induced pregnancy. After an incubation period of 2 to 3 days. Host mothers will birth 25 to 50 instances of SCP-400 during her next sleep. Instances of SCP-400 have not been successfully tracked after birth. Maximum interval of dormancy before SCP-400 must initiate another infestation is unknown. After breeding behavior begins, the cycle will repeat once weekly for the duration of the infestation. No natural limit to SCP-400 infestation timeline has been observed. See Addendum 402. Of recorded infestations to date, all have occurred in the southeastern United States in rural or mountainous areas, and in some cases have gone unnoticed for as long as 9 months. Improved detection and extermination of SCP-400 instances is considered a high research priority.